From a nurse that killed 8 of her patients by injecting air into their IV lines, to a doctor that is thought to have killed more than 250 people, we take a look at 11 doctors and nurses who killed their patients. Number 11. Beverley ALLITT. There's a certain level of evil that distinguishes a murderer from the rest. In 1991, during a 59-day period, Beverley ALLITT attacked 13 children between 7 weeks and 5 years old. 4 of her victims were actually killed. What she would do is administer large amounts of insulin, which would send her patients into a coma. She would then inject air bubbles into their IVs. Her biggest mistake was being the only nurse on duty when these attacks took place, not to mention the only one with access to drugs. She ultimately was given 13 life sentences after being found guilty of 4 of the children's deaths in 1993. She could be released after serving a minimum of 30 years, but because of the risk she poses to the community, most people feel that will never happen. Number 10. Donald Harvey. Donald Harvey claims to have murdered 87 people in and out of a medical setting. He considered himself an angel of death, but if you were a patient, this was the last orderly you wanted to clean your room. He would do things like inject deadly cocktails into IV lines, suffocate patients, poison them, or insert a wire coat hanger into a catheter line, causing an abdominal rupture. It took 17 long years for authorities to apprehend Donald Harvey. After being charged, he pled guilty so that he could avoid the death penalty, and during the trial admitted that killing patients began as an act of mercy, but quickly turned into the slaughter of anyone who annoyed him. He's currently serving 28 life sentences, and since his first parole hearing will be in 2043, we'll be safe from him for a few more years. Number 9. Anders HANSSON. After being found guilty of killing long-term care patients between 1978 and 79, Anders HANSSON is widely considered to be the most deadly serial killer in Swedish history. He worked as an orderly at the Malmö Östra Hospital and was only 18 years old at the time. He would take cleaning products that he was given to clean the hospital rooms and use them to poison defenseless elderly patients. 15 people were victims of attempted murder, and another 15 have been confirmed dead. Rather than prison, HANSSON was sentenced to be confined in a psychiatric facility where he still resides. Number 8. ARNFINN NESSET. ARNFINN NESSET is suspected to have murdered upwards of 138 people, making him by far Norway's most prolific serial killer. After spending time as a nurse, he eventually became the manager of a nursing home, but rather than providing quality care, he instead started injecting his patients with fatal doses of a powerful paralytic called succinylmethonium chloride. NESSET was eventually captured, and although nobody's going to get off scot-free for killing 138 people, he actually got the next best thing. He was only convicted of 22 of the murders, and his sentence, a mere 21 years. The kicker? Due to good behavior, he was released after serving only 12 years. Number 7. SONJA CALEFFI. Suffering from anorexia and depression, SONJA CALEFFI was quite a troubled teenager. She was described as being antisocial and withdrawn even early in her adult life. She worked in several different healthcare facilities during her career after being trained as a nurse. After being employed at St. Anna Hospital for just 1 month, SONJA injected an air embolism into IV lines of 8 terminally ill patients, causing their deaths. She then began working at Manzoni Hospital, where an astonishing 18 more patients were killed before she was finally arrested. In court, she admitted that she enjoyed the attention created by her vile actions, but in later interviews, she claimed that she didn't even remember the killings. The victims' families were outraged even further when they heard her final sentence. Just 20 years. Number 6. JOSEF MENGELE. Although we heard the term Angel of Death associated with other people on this list, this was actually a nickname of Dr. Joseph Mengele, who is perhaps the most evil man on this list. During World War II, Mengele was an SS officer and German doctor, and was in charge of Auschwitz, one of the most notorious concentration camps. Prisoners would be selected and separated, where some would go immediately to gas chambers, and others would become test subjects for gruesome medical experiments. Mengele managed to evade liberating armies just before the camp was taken, and although 1.1 million prisoners of war were murdered at Auschwitz, he was never made to answer for his atrocious war crimes. Number 5. Daniela Poggiali. Charming Italian nurse Daniela Poggiali is suspected of up to 38 murders, most of which were elderly patients. Over a 3-month period, 38 out of her 86 patients died, which became somewhat suspicious. An overdose of potassium chloride in the patient's IV lines was her preferred method, but killing her patients just wasn't enough for this woman. After their death, she would take out her phone and take selfies with their dead bodies. Reinforcing her twisted nature, she stated in court that the reason she killed these patients was because she thought they or their families were, quote, annoying. In 2016, she was sentenced to life in prison. Number 4. Louay Omar Mohammed Itai. Between 2005 and 2006, this Iraqi medical doctor murdered 43 patients in under a year. He would pretend that he was helping wounded officials, policemen, and soldiers, but instead he was really injecting them with huge amounts of blood-thinning medication. These drugs, called anticoagulants, would cause his victims to bleed out and die. Dr. Louay was not an angel of mercy, and he didn't kill his victims for being annoying. His murders were motivated by politics. During the Iraq War, he was recruited into an insurgent group. He targeted patients associated with the U.S. coalition by using his position as a doctor. When asked about his murderous practices, he said, quote, "I made a mixture of drugs and injected them. They were dead in 3 hours." Number 3. Linda Hazzard. For those with weak muscles or bones, visiting an osteopath may give them hope for recovery. Osteopathy, you see, focuses on strengthening bones and muscles without using drugs or surgeries. This is how Linda Hazzard would work her way into the lives of her patients. Although she didn't have a medical degree, she presented herself as an osteopath, and in the early 1900s, she was allowed to practice medicine under an alternative medicine loophole. She claimed her method of treatment was to have her patients fast. In reality, she would check her patients into a sanitarium and starve them to death. After spending time under her care, patients would become so weak that they couldn't escape, and as many as 14 people are believed to have been her victims. In those times, methods of investigation made it difficult to prove her guilt, and as a result, she ended up serving just 2 years in prison. And those were for other minor offenses. She was eventually able to reopen another facility, and she continued doing the same work. In a stunning case of you reap what you sow, Hazzard herself finally died during a fast. Number 2. Shiro ISHII. We'll leave it up to you to decide what's worse. The fact that Shiro ISHII performed terrible experiments and killed hundreds, if not thousands of people, or the fact that he got away with it. During the Sino-Japanese War, this surgeon experimented with biological warfare agents in the now infamous Unit 731. He performed sickening medical experiments, including forced abortions on Chinese prisoners of war. He even tested chemical weapons on them. In order to cover his tracks, he ordered 150 prisoners to be killed and then blew up the facility when it became clear that his side was going to be defeated. So how did he get away with it? After being arrested by US forces, Shiro ISHII was able to negotiate a deal where he received immunity in exchange for the data he received by doing his experiments. Number 1. Harold Shipman. This general practitioner from Britain is the only British doctor to ever be found guilty of murdering his patients, and is therefore regarded as one of the most prolific serial killers that ever lived. There were certain red flags early in his career as a doctor. He was caught forging prescriptions for pain medication, which he would then take himself. After being sent to drug rehab and paying stiff fines, he went back to practicing medicine and continued to build his career. Most of Shipman's victims were elderly patients who he overdosed with morphine. And while it's believed that he may have killed up to 250 people, he was only charged with 15 deaths. After being caught, Shipman avoided answering for his crimes by consequently killing himself. If you like this video, why not hit that like button and remember to hit the subscribe button for more videos every 2 days.